Hey, thanks for joining me. I'm Dr. Steve Grinstead. Today I want to talk about how knowledge is power when trying to effectively manage chronic pain. Now, I've been living with my chronic pain for a long time, and I had to learn these lessons, and I've taught them to thousands of people. And today I want to talk about my book, Thank You Adversity for Yet Another Test. It's a body, mind, spirit approach to help people find relief from chronic pain suffering. And to do that, they have to understand the overwhelming problems and the obstacles that get in the way of moving out of the problem into the solution. I chose to utilize 4 composites of some complex chronic pain patients that went through my treatment program, and I also used some of my personal and other patient stories to make the book come alive, so you can see how people were when they came in and what happened when they went out. One of the very first things I teach my patients is how to tell the difference between their physical pain, which is that ascending signal that goes up to the brain that warns us there's something going on, to the descending signal that sometimes when chronic pain gets distorted, amplified, and it starts causing problems. That's the psychological, emotional component of pain, and it often leads to suffering. So when the pain signals keep going 24/7, day in, day out, week in, week out, month in, month out, sometimes decades, that the pain brain effect kicks in. The pain gets remodeled. So one of the first things I explore when I work with someone is help them differentiate between pain and suffering. I give a good example of this in my book and show how a couple of my patients were with pain versus suffering when they came in, and then throughout the book how they were able to lower the psychological, emotional levels of pain, which in fact, without changing much on the biological side, started reducing their perception of pain of the physical symptoms. So that's just one of the great tools in my book, Thank You Adversity for Yet Another Test. So as a gift for watching this video, I'm going to offer you a 20% discount at my publisher's site, and the information will be with this video. So please take advantage of this. And remember that knowledge is power indeed, but knowledge without action is useless. So we need to help people see that the important thing with chronic pain management is to be active participants instead of passive recipients, and take a proactive action plan. This book is meant not just for treatment professionals, but also for people living with chronic pain. As a matter of fact, many people that did the pre-review of my book before it was published and wrote endorsements were people living with severe chronic pain, and how this book was very helpful for them. So please take it to the Book Locker page. You can check out a free section of the book on this page, and I encourage you to share this information with anybody you know that's working with people with chronic pain, or anyone that has chronic pain. And speaking of that, when chronic pain happens, it doesn't just affect the person, it affects their family and friends. That's why an entire chapter of the book is focused on the role of family and friends in chronic pain management. And this will be very helpful for family members. Thank you for joining me today, and please make sure to check out my book today. Thank you.